Okay, let's unpack this. Today, we're diving deep into a topic that is guaranteed to wrinkle a few noses, but it's incredibly common
Hmm.
and frustrating, I think, for cat owners and vets alike. We are zeroing in on a very specific, persistent, and sometimes, well, baffling cause of diarrhea in cats.
Indeed, we've really immersed ourselves in the source material, research articles, clinical findings, all focused on feline trichomoniasis. Like you said, not glamorous, but understanding it is key.
Why is that?
Because it's a classic case of this tiny organism causing a really significant and frankly stubborn problem.
Right, and our mission for this deep dive is basically to pull out the essential knowledge from these sources.
Mm.
We want to understand exactly what this thing is, feline trichomoniasis,
Hmm.
who gets it, why it's such a pain to diagnose and treat, and really just get the absolute need-to-know insights so you, the listener, can be truly well-informed.
Yeah, we'll guide you through the life of this sneaky parasite, the challenges vets face trying to pin it down, and even touch on some surprising bits like the fact it actually got a name change.
Yeah. Oh, intriguing. Okay, let's jump right in then. What exactly is feline trichomoniasis? What's the culprit here?
Okay, so at its core, it's caused by a specific protozoan, single-celled parasite. Its current name is Tritrichomonas legburni.
Diaburny. Okay.
But, and this is important if you're looking at older stuff, you might see it called Tritrichomonas fetus.
Wait, fetus? Isn't that the one? Doesn't that cause problems in cattle? Reproductive issues?
Exactly, and that's precisely why the name change happened, as the sources explain. T. fetus is known for causing infertility, abortions in cattle.
Right.
When a similar bug was found causing diarrhea in cats, they first thought, okay, same thing. But then genetic work showed the cat one is actually distinct.
Ah, okay.
Different enough to get its own name, T. legburni.
Hmm.
So related, yes, but definitely separate from the cattle pathogen.
Phew, okay. That's a bit of a relief. It's not exactly the same thing causing those major cattle problems. So what does this T. Blankburny look like under the microscope, I mean?
It's tiny, kind of pear-shaped, and it has these little whip-like tails,
Mm-hmm.
flagella, that help it move.
Okay.
And it's anaerobic. Doesn't
Yeah.
need oxygen. Prefers places like, well, the inside of a cat's gut.
And where specifically in the gut does it like to sort of set up shop?
Its main hangout is the mucosal surface of the lower intestinal tract. So the very end of the small intestine, the ileum,
Mm-hmm.
the cecum, and especially the large intestine, the colon. And this location, the colon, is absolutely key
Why is that?
because that's why it causes the symptoms. We see that classic large bowel diarrhea.
Got it. Colon parasite equals large bowel problems. Makes sense. And its life cycle. Is it like super complicated? Some parasites have crazy
You-
life cycles.
This is one of the really interesting points from the sources. It's actually surprisingly simple.
Oh.
It only exists in one form, one stage. It's called the trophozoite,
Just one.
just the trophozoite. And this is a huge difference compared to something like Giardia. There is absolutely no cyst stage for Trichomonas blackburni.
No cyst stage at all. Wow. That feels important. How does it spread then if there isn't a tough cyst that can survive outside?
Yeah, that simplicity is key for thinking about control, actually. Transmission is purely fecal oral.
Mm-hmm. Great.
Infected cats shed these trophozoites, which are pretty fragile, remember, in their poop.
Mhm.
Other cats get infected when they swallow those trophozoites.
And that's like grooming.
Exactly. Grooming after using a contaminated litter box, direct contact with infected feces, contaminated surfaces, that kind of thing.
Okay. And that's why it becomes such a nightmare in multi-cat situations like shelters or catteries.
Precisely. The sources consistently point to multi-cat environments as the highest risk. Shared litter boxes are basically ground zero.
Right.
The density of cats, sharing resources, grooming each other, it just makes fecal-oral spread incredibly efficient. Shelters, breeding places, even just homes with several cats, much higher prevalence.
And you mentioned purebreds sometimes show up more.
Yeah, likely because they often come from or spend time in cattery environments when they're young. More exposure risk.
So these trophozoites, because they don't have that protective cyst, they're fragile outside the cat.
Yes, that's the flip side. Limited survival time. They might last a few days in moist poop,
Mm-hmm.
but drying out, sunlight, they hate that. Which is good news when we talk about cleaning later.
Okay. And is this something I need to worry about catching? Or my dog getting it from the cat?
That's a common worry,
Yeah.
definitely. But the sources are pretty clear and reassuring here. T. blackburni is considered host-specific to cats.
Phew.
It is not considered zoonotic, meaning it doesn't infect humans. It's not known to infect dogs or other pets either.
That's good news.
Yeah. I mean, general good hygiene around pet waste is always smart, obviously. But the specific risk from this parasite to humans or dogs is basically zero.
Okay, definite relief there. So we know what it is, how it spreads between cats. It's cat-specific. Now, who is most likely to actually get sick from it? Because you mentioned not all infected cats show signs.
Right, exactly. Infection doesn't always mean illness. The key risk factors for actually developing the clinical signs, the diarrhea, number one is young cats and kittens.
Ah, the little ones.
Yeah, typically under 2 years old. They are way more likely to show symptoms. Older cats, they can definitely be infected, but often they're just carriers, showing no signs at all.
Kind of like how kids get certain illnesses worse than adults sometimes.
That's a pretty good analogy, yeah. And like we touched on, those multi-cat environments, they're a huge risk factor, not just for catching it, but the stress in those places can also make symptoms worse.
Stress. How does stress connect to a gut parasite causing diarrhea?
Well, things like overcrowding, moving house, getting neutered, even just a sudden diet change. These stressors can impact the cat's immune system or gut function. That can make existing diarrhea worse, or even trigger symptoms in a cat that was previously fine or had gotten better.
Wow, stress really does affect everything in cats, doesn't it? Are there other health things that make it worse? Co-infections.
Yeah, definitely. Concurrent infections are pretty common. You often find cats with Tritrichomonas also have Giardia. That's a really frequent partner in crime.
Okay.
Or other gut parasites like Isospora, Cryptosporidium, even viruses like FLV or FIV. Having multiple things going on definitely complicates the picture, diagnosis, everything.
So why exactly does this parasite cause diarrhea? What's it actually doing down there in the colon?
The sources suggest a few mechanisms. It seems to mess with the cat's normal gut bacteria. It definitely sticks really close to the gut lining. And it might produce nasty stuff like cytotoxins or enzymes that directly damage the intestinal cells. That leads to inflammation, colitis, and boom, diarrhea.
Okay, so this pear-shaped critter, no cyst stage, spread by poop, loves young cats in groups, hangs out in the colon, irritates the lining. What does this actually look like for the owner? What are the dead giveaway signs?
The absolute hallmark sign, the thing that should make bells ring, is chronic large bowel diarrhea.
Okay, describe that. What does large bowel diarrhea look like in this case? Is it just loose stool?
It often has a very distinct look and smell. Consistency is usually soft, sometimes described as cowpat-like.
Okay, vivid.
Sometimes totally liquid. And very often you'll see visible mucus mixed in and adore streaks of fresh red blood. That's called hematochezia.
Mucus and blood, got it.
And one really characteristic thing mentioned over and over in the sources is an extremely foul odor, like really bad.
Yeah, okay, definitely something you'd notice then.
Oh, absolutely. And because the colon is inflamed, that's colitis, the cat might poop more often.
Right.
And they often show straining to defecate. It's called tenesmus. They strain even if the poop is soft or liquid.
Straining with diarrhea, that sounds awful for the cat. Really uncomfortable.
It really is. And all that irritation around the back end can cause itching. So you might see the cat scooting his bottom on the floor or licking the anal area excessively. The area might look red and sore. Increased gas, flatulence can happen too.
Wow.
And in really severe long-term cases of straining, you could potentially even see the rectum kind of push out temporarily, the rectal prolapse.
Whoa, okay, so it's not just messy, it's genuinely impacting the cat's comfort and health quite significantly. What about their general condition, though? Are they acting sick? Losing weight?
See, this is one of the tricky parts.
Yeah.
While chronic diarrhea can over time lead to weight loss and poor condition because they're not absorbing nutrients well.
Makes sense.
Many cats with Tritrichomonas, surprisingly, keep a good appetite, stay playful and active, and seem otherwise bright and alert, despite having this persistent, often really smelly diarrhea.
That must be incredibly frustrating for an owner. The cat seems okay otherwise, but you're dealing with this constant mess and, discomfort for them. How long does this typically last?
It can vary. The diarrhea might be nonstop, or it can wax and wane, get better, get worse. And this can drag on for weeks, months. The sources say even up to 2 years.
2 years? Wow.
Yeah. One source mentioned the median duration of diarrhea is about 9 months, and that most cat signs do eventually resolve on their own, usually by the time they're 2 years old. And this is critical even when the diarrhea stops. The infection often doesn't.
So they can become silent carriers, still shedding the parasite even if they look fine.
Exactly. Still shedding, still potentially spreading it.
Okay, so if you've got a cat, especially a young one, from a shelter or breeder with chronic super smelly cowpat diarrhea, maybe with mucus or blood, Tritrichomonas sounds like a prime suspect. How do you actually confirm it? You said routine fecal tests don't work.
That's right. Your standard fecal float test looking for worm eggs It won't catch Tritrichomonas trophozoites. They just don't float in the solutions used.
Okay.
So you need specific tests designed to find either the moving organism itself or its DNA.
What's the first step in testing usually?
Well, clinical suspicion is always number one. That pattern of signs we just discussed, chronic, foul, large bowel diarrhea, young cat, multi-cat home, maybe didn't respond to standard dewormers or Giardia treatment,
Right.
Tritrichomonas absolutely needs to be on your differential list.
Okay, so the vet suspects it. What tests can they actually run?
There are a few main methods. First, there's the direct fecal smear or a wet mount.
How is that done? Sounds simple.
You take a tiny speck of fresh diarrheic feces, and I mean fresh, ideally straight from the source, like from the rectum, to avoid litter getting mixed in.
Okay.
Mix it with a drop of warm saline on a microscope slide, pop a cover slip on, and look under the microscope immediately, right away.
Why the rush? Why immediately?
Because those trophozoites are so fragile, they die quickly if they dry out, get cold, or are just outside the body too long. You need to catch them while they're still alive and moving.
So you're looking for little swimming things.
Exactly. You're searching for these motile trophozoites moving amongst all the normal fecal stuff.
And what's their movement like? How do you tell them apart from other things?
This is key for identifying them visually. The sources describe their movement as kind of jerky or erratic, sometimes a distinctive tumbling forward motion. They've got that pear shape, the flagella, and a noticeable undulating membrane running down their side.
How is that different from, say, Giardia? People might confuse them.
Good question. Giardia trophozoites have a different shape, often described as teardrop-like, with that concave disc on the bottom. And their movement is usually smoother, like a falling leaf.
Oh, okay.
Tritrichomonas movement is much jerkier, and that undulating membrane is a big clue. But yeah, it can be tricky. There's also another gut flagellate, Pentatrichomonas hominis, which is generally considered non-pathogenic. They can look similar and cause confusion.
So the direct smear sounds like it needs a really good sample, a quick look, a trained eye, and maybe isn't super reliable.
You nail the limitations. Sensitivity is low. One source cited maybe as low as 14%. It really depends on getting that perfect fresh liquid sample and looking immediately. If the sample was refrigerated, forget it for this test.
Ugh, okay, that sounds like you could easily miss it. What's the next option if the smear is negative but the vet's still suspicious?
A more sensitive approach is fecal culture. There are special commercial kits, like the InPoach TF Feline system. Yeah, it's a little pouch with a selective growth medium. You add a small fecal sample, incubate at room temp or a bit warmer usually works, and then you check a drop under the microscope every day for maybe 11 or 12 days.
Looking for the swimmers again?
Exactly.
Yeah.
Looking for those motile trophozoites to grow in the culture medium.
That takes a while, up to 12 days. Is it much better than the smear?
It is definitely more sensitive than the direct smear. Studies put sensitivity around 55%, maybe a bit higher, but it still needs live, viable organisms in the sample to start the culture.
Okay.
One advantage is that things like Giardia and that other trichomonad P. hominis don't tend to survive or grow well in that specific culture medium after the first day or so. So if you see growth later, it's more likely to be T. blackburni.
Right. So smears fast but misses a lot. Culture is slower, better sensitivity, still needs live bugs. What's the absolute best way, according to the sources? The most reliable?
The sources are really clear on this one. Fecal PCR, polymerase chain reaction. That's considered the gold standard test for Tritrichomonas blackburni.
PCR. Why is that the gold standard here?
Because it's by far the most sensitive and specific test available.
Correct.
It doesn't need live organisms. It detects the parasite's actual DNA.
Ah,
So
okay.
even if the cat isn't shedding many organisms or if they've died in transit to the lab, the PCR can still pick up the DNA signature. DNA is way more stable than the live trophozoites.
And how does that work logistically for the vet or owner?
You collect a small fecal sample again, ideally diarrheic, clean collection if possible, and send it off to a specialized veterinary lab that runs the Tritrichomonas PCR test.
And results?
Usually much faster than culture, often back within a few days. And it's highly reliable for confirming infection.
Got it. So suspect the signs, do specific tests, and PCR is the most definitive confirmation. Now, $1 million question, can we actually stop the diarrhea? How do you treat this thing?
Yeah, this is where it gets really challenging. The sources all emphasize that treatment is difficult. Getting rid of the parasite completely is hard, and relapses are depressingly common.
Is there even a drug that works? I feel like I read somewhere that a lot of the usual stuff doesn't touch it.
That's a key point from the research, absolutely. Many standard antibiotics and antiparasitics just don't work against T. blackburni. including metronidazole, which vets often use for general diarrhea.
Metronidazole doesn't work.
It might seem to help temporarily, maybe by affecting other gut bacteria, but it does not clear the Tritrichomonas infection itself. However, there's one drug that is considered the drug of choice,
Okay.
and that's ronidazole.
Ronidazole, okay. How does that one work? Why is it different?
It's in the same family as metronidazole, a nitramidazole, but for some reason, it seems to be specifically effective against Tritrichomonas. The thinking is it messes with the parasite's DNA or its energy production.
And what's the recommended treatment plan?
The protocol that comes up consistently in the research is 30 milligrams per kilogram of body weight, given orally, once a day, for 14 days.
Okay, 30 millikilograms once daily, 14 days. Sounds straightforward enough, but I sense a but coming. The sources seemed really cautious about this drug.
They absolutely do, and for good reason. You cannot use ronidazole lightly. First big thing, it's technically an unlicensed drug for cats in most places.
Meaning not officially approved for cats.
Right, so vets use it off-label, which happens a lot in vet med, but it means extra caution is needed.
Okay. What's the main reason for caution with ronidazole specifically?
The biggest concern, the one everyone needs to be aware of, is its narrow safety margin. And the most significant potential side effect is neurotoxicity.
Neurotoxicity affects the brain, the nervous system. What would you actually see? What signs?
Yeah, exactly. Signs can range from lethargy, not eating, to poor coordination, like stumbling or wobbling, that's ataxia, even tremors, or potentially seizures.
Seizures? Wow, that sounds incredibly serious and scary.
It absolutely is. And while it's more likely if the dose is too high or if treatment goes on too long, the sources are clear that neurotoxicity can happen even at the correct therapeutic dose.
So it's not something you can ignore?
Definitely not.
Yep.
It's a real risk.
So, if a cat is on ronidazole and the owner sees any of those signs, wobbling, shaking, acting spaced out, seizures, what do?
The advice is unanimous and urgent. Stop the drug immediately. Contact the vet right away. The hope is the neurological signs might be reversible once the drug is withdrawn, but it's a serious potential complication. You have to monitor really closely.
Okay. And there was something about handling the pills, too.
Yes. Especially if they're compounded capsules, it's recommended that people wear gloves when handling them, just to minimize any potential exposure themselves.
Right. Given these risks, neurotoxicity, even seizures, should a vet or owner ever just try ronidazole to see if it helps the diarrhea without confirming the infection first?
No, absolutely not. The sources strongly advise against that. Ronidazole should only be used in cats with a confirmed Tritrichomonas infection proven by PCR or maybe culture.
Okay.
Using it just in case is really not worth the risk of those serious side effects.
Makes sense. So ronidazole is the go-to drug, 14 days, but with these significant neurotoxicity risks, needs super close monitoring, only for confirmed cases. Does it actually cure them? Does it reliably get rid of the parasite for good?
This is another tricky part. While ronidazole is the most effective drug we have right now, the sources indicate that it's better at resolving the clinical signs, the diarrhea,
Okay.
than it is at achieving complete parasitic clearance. So the diarrhea often gets much better or even stops completely.
That's good.
But the cat might still be carrying the parasite just without symptoms. They can remain subclinical carriers.
So even after treatment, they could still be infected.
Yes, that's a major challenge with this infection. And again, just to stress, other drugs like metronidazole, generally ineffective for clearing T-blag burning.
Right. So besides the drug, what else is important? Supportive care.
Yeah.
Cleaning.
Oh, absolutely critical. Supportive care and especially environmental management are huge. Diet can play a role, maybe a highly digestible food or adding some fiber can help firm things up. Probiotics might support gut health too.
And tackling that multi-cat environment factor.
Yeah, minimizing stress is helpful since stress can trigger flare-ups. Avoiding overcrowding sudden changes. But the single most vital piece of environmental management, stressed in all the sources, is litter box hygiene.
How vital are we talking? Like scoop more often?
Way beyond that. Because the parasite spreads through poop, you have to break that cycle relentlessly. Scooping daily is minimum, ideally twice daily. And disinfecting the litter boxes frequently.
How frequently? And with what?
Some sources recommended daily disinfection with dilute bleach and letting them dry completely, preferably in the sun if possible. Remember those trophozoites hate drying out and UV light?
Ah, okay. So bleach and sunshine are your friends here.
Big time. Also, cleaning food and water bowls regularly, washing bedding, cleaning surfaces where fecal matter might have landed, and keeping the cat itself clean. especially their hind end, so they don't re-ingest parasites while grooming.
Okay.
And ideally, though it's tough, in a multi-cat home, you'd isolate the infected cat and test all the cats.
Wow, that sounds like a massive undertaking,
Right.
but necessary to really stop it spreading around.
Okay, putting it all together, what's the overall outlook? The prognosis for a cat diagnosed with this?
Okay, so prognosis for the clinical signs for the diarrhea stopping, it's often good, especially with ronidazole treatment or even just with time, as many younger cats eventually outgrow the diarrhea.
Okay, that's encouraging for the poor cat's comfort level.
Yes. However, the prognosis for achieving a complete cure for getting rid of the parasite entirely, that's considered guarded.
Guarded, meaning not guaranteed.
Exactly. Like we said, even after successful treatment or after the diarrhea resolves on its own over months or years, the cat can remain infected, a subclinical carrier.
And potentially still spread it to other cats.
Correct. And because they can remain carriers, or just because the infection is hard to fully eliminate, relapses of diarrhea are common, even after they seemed better. These relapses are often triggered by stress, a diet change, maybe another illness pops up. So it sounds less like a treat it and it's gone situation and more like something you might have to manage long term.
That is a very accurate summary. It's often a challenging chronic problem that demands patience, diligence, and a multi-pronged approach. Not just drugs, but hygiene, stress management, the whole package.
Okay. Based on everything we've covered from the sources, what are the absolute key things an owner needs to hear? What do you emphasize?
Right. Key takeaways for owners.
Yeah.
First, recognize those signs.
Yeah.
The chronic, really foul-smelling large-bowel diarrhea, often with mucus or blood.
Okay.
Second, understand it's highly contagious between cats. Fecal-oral route. That's why it's such an issue in multi-cat homes.
Got it.
Third, hammer home the importance of the right diagnosis. Routine tests miss it. PCR is really the key to confirming Tritrichomonas. Don't guess.
Right. Test, don't guess.
Fourth, explain Ronidazole. Yes, it's the drug, but be upfront about the off-label status, the very real neurotoxicity risk, and the need for strict dosing and super careful monitoring for side effects.
Okay. And the non-drug parts.
Absolutely crucial. Emphasize the critical role of meticulous litter box hygiene, daily scooping, frequent bleaching, drying, and general environmental cleaning to stop reinfection and spread.
Non-negotiable.
Non-negotiable. Help them understand that this takes patience. Improvement isn't instant, a complete cure isn't guaranteed, and relapses can happen. Manage expectations. Reassure them again. It's not zoonotic to humans, but, good hygiene is always smart anyway.
Yeah.
And mention that stress link for relapses.
Okay. So, summing it up. Specific bug, specific signs, specific test, PCR, specific treatment with specific risks, and relentless cleaning.
That's the essence of it. It requires a really informed and persistent approach from everyone involved.
Yeah. This deep dive really highlights how complex this is. It's not just cat diarrhea. Understanding it's Tritrichomonas blackburni, knowing about the lack of a cyst stage, why PCR is vital, the ronidazole tightrope walk, the cleaning protocols, the potential for carriage and relapse. It really changes how you have to think about it.
It absolutely does. And, thinking about the fact that cats can remain carriers even after symptoms resolve, even after treatment, and that relapses are common. It really makes you ponder, doesn't it? It poses a kind of provocative question for you, the listener, to think about. What does this whole situation tell us about the incredibly complex dance between a parasite, the host's immune system, and the environment they live in, especially in these multi-cat dynamics? It's a potent reminder that sometimes, with chronic conditions like this, the goal isn't necessarily complete eradication, which might not even be possible. Sometimes the most realistic, maybe the most humane goal, is effective long-term management, keeping the cat comfortable, minimizing symptoms, and preventing spread as best we can within that complex system.
That's a really powerful thought to end on. It's not just about the bug, it's about managing the whole ecosystem around it. Thanks for walking us through such a tricky and, frankly, smelly topic.
My pleasure. It's an important one to understand.